Ulcerative colitis is a disease that causes inflammation in the protective lining of the colon and rectum, which make up the large intestine, and can result in the creation of ulcers. Over time, these ulcers may likely begin to bleed. Inflammation also triggers the colon to frequently empty, often resulting in extreme bouts of diarrhea. For many people, this combination can create a multitude of difficult circumstances.
We were out in Arizona hiking, and all of a sudden I had a problem and had some symptoms that I just was not happy with.
65-year-old Michael Lowe retired 3 years ago from a career in banking. He lives in Chicago. Around the time of his retirement, Michael experienced his first symptoms of ulcerative colitis, though most ulcerative colitis patients are in their mid-30s when symptoms first appear.
And all of a sudden this just came out of nowhere, and we couldn't sort of relate it to any kind of food or anything like that. It was just very, very debilitating, and I didn't think it was because I had totally neglected myself, had annual medicals, and a job that was, I would say, probably at the high end of stress.
But everyone has a theory about it, and the most common things that I hear from my patients are that it was their diet in some way or that it was stress. The truth of the matter is that we have yet to identify any specific behavior that in and of itself triggers the onset of this disease.
Ulcerative colitis doesn't seem to play favorites when it comes to gender. Men and women share equal risk in this disease. Ulcerative colitis can occur at any age, but more often happens to people in their 20s and 30s. For some, it can happen later, in their 50s and 60s. Although Caucasians have the highest rate of the disease, it can occur in any race. If you're of Jewish descent, your risk is even higher.
Ulcerative colitis runs in families. Now, having said that, only 10% of the people who come into my office with ulcerative colitis will tell me that other members of their family have this disease. So what this tells us as scientists is that this is what we call a complex genetic disease.
Saying hi.
Jocasta Britt is 35 and lives in Pittsboro, North Carolina with her husband and 10-month-old daughter. Jocasta was diagnosed with her ulcerative colitis 5 years ago. Having to deal with this life-changing condition at such a young age was quite a revelation for her.
A lot of trips to the doctor, a lot of trying to become aware of my body and what was going on, and accepting that I had an illness that that wasn't just going to go away. It wasn't just a cold or just, it was serious, and so I was going to have to face it and deal with it.
Dr. Plevia agrees with Jocasta's belief that patients should be proactive in dealing with their symptoms, which may also help in warding off any possible misdiagnosis at the beginning of medical treatment.
When physicians miss the call on quickly diagnosing ulcerative colitis, it's because they usually assume that a patient has another set of disorders that we call irritable bowel syndrome.
As mentioned, ulcerative colitis is an inflammatory bowel disease, or IBD. Unfortunately, this can sometimes be mistaken for irritable bowel syndrome, or IBS. They are not the same, however.
Irritable bowel syndrome is a lack of coordination in the muscle activity and the sensation within the small and large intestine. Inflammatory bowel disease is caused by inflammation.
Initially, patients often seek relief from their ulcerative colitis symptoms by first seeing a general practitioner or internist. It is then likely that the patient will be referred to a gastroenterologist. Gastroenterologists specialize in diseases of the digestive system, including inflammatory bowel diseases such as ulcerative colitis.
I think it's a very stress-related disease. How you handle stressful events, and I tend to internalize those. I tend to hold on to them and think about them and stew about them.
We're studying right here in the laboratory is the role stress may play in making inflammation worse in people with ulcerative colitis. So these are important questions that people ask. But I think this has also led to a common misperception about ulcerative colitis that it's important to clarify. This is not something people have done to themselves. It's not our patient's fault. These factors may modulate these diseases, but it didn't cause it.
I would ask the doctor to educate me. You know, what is this? What can I expect? What's the latest as far as research? What's out there? What can I do for myself?
Armed with this information, it's important for you to be an advocate for yourself with your physician. You want to say, why am I having these symptoms? Can we do better to treat it?
Some patients will have repeat symptoms or flares. When that happens, it's very important that they see their doctor right away. And as we've said, it's also important for patients to be actively engaged in their medical care from the very start of their symptoms. The more you know about ulcerative colitis before seeing your doctor, the more you can ask questions that will help you understand your condition more clearly. To answer any specific questions you may have, be sure to contact your healthcare provider.